How are you feeling? Should we do another one?
Yes.
Yes?
Yes.
Who's next?
Yes.
Okay. Do you want 1 minute or more?
Is it possible more is better?
2 minutes?
Yes, it's good.
Okay. Okay.
Okay, I'm ready.
Okay. Right. 5 minutes.
Yes. Um, Hello. I am Dr. One of surgical registrar in this hospital. How can I help you?
Yes, doctor. This is about this. This thingy in my back is I think it's a big lump, and I think it is very bad looking and it's very ugly. So my doctor said that it is a benign tumor, but how is it possible? A tumor is benign, and I think it is probably cancer.
I can totally understand your concerns, and I think you're worried about this lump. Maybe is a malignant or a cancerous tumor. Yes, is it correct?
Yes. How would you know it's not cancer? Because yeah, the consultant looked at it and he said it's not cancer, just like that. And how could you say that?
Yes, at the when we saw for example, vision of the view of the lesion or lump, we can understand that what it is, benign or not, and the lump in your back is more common in the, for example, middle-aged patient, and it is more likely that has a the fat lump under the skin. But
Right.
for sure, after excision of the lump, uh, the lamp which sent to the pathology laboratory to examine the uh, lump, uh, if it is benign or not. After that, we told you certainly it is benign or not. Uh, is it okay to you?
Yes, but this. I have a question about this scar on my back. I mean, if you cut it off, then would I have a scar on my back?
Yes, as you know, the lamp is very big on your back. If we have excised your lamp, we have a scar on your back, and if I wanted to um, explain to you about the scar, after the sometimes, for example, 6 months or 1 year, the scar minimized and the, for example, bad view, but we can help to minimize this by using some steroid strips for a month on your back. Do you know what it is?
Yes, I know. I have seen those. Okay. I was told that I have to come back in 2 weeks' time for the
Yes.
result of the lump, whether it is cancerous or not. Why does it take 2 weeks? It is something so important.
Yes, it's so important to know, and uh, mm, I appreciate your concern that you want to know as soon as possible the result. It will take 2 weeks, and the laboratory answer the results to us to know about for example, benign or malignant tumor. And the second explanation is after the surgery, we want to see your wound uh, at the 2 weeks. Is it infected or not, and what is your improvement, your wound. And
Okay.
this is the why you know about 2 weeks time.
Okay. Right. But doctor, if you take it out, does it happen in another place? Or, I mean, does it regrow?
Yes, it is more likely in the lump is grow on the other side, but it is not so important to you to think about that, because if it grow more, we will excise it like this.
Okay. But what if we don't take it out at all? What happens?
Sorry, can you ask
What
repeat?
if what if we leave it and not remove it at all?
No, the when doctor performed the surgery, he tried to exercise totally, and they he didn't. He don't. He will. He won't uh, remain some lump in your back. Mm, Please don't worry about this.
No, no. What I'm saying is, if I might have it again, and on the other side, or well, if it is not cancerous, we should leave it. And why should we take it out?
Yes, you should leave it without any concerns, and you don't worry about the lesion because it is benign.
Okay. All right. Our time is over. No, I mean, no, my last question was, well, if it is benign, so we don't need to remove it. So what
Oh
is the
yes,
answer to that? The answer is that, well, we don't know yet, but it is very likely to be benign, but not 100%. Yeah.
yes.
Okay. So, yeah, how did you feel?
I don't feel very well uh, because
Uh,
because I couldn't uh, do some information gathering or for example, providing structure. I think uh,
uh, okay. But what was good?
relationship building is so-so. or
Yeah, no, it
good?
was good. You introduced yourself. You said who you are.
Yes.
It's a surgical theater. Yes. Okay.
Register, yes. And exploring ice is very good.
Okay.
Signposting is very good.
Did you summarize?
No,
No. Okay.
and uh, information gathering, no, I don't do that. It is in fact a
Uh,
negative. Information giving is good.
okay. So,
Checking and chunking and checking is so.
so information giving. Okay. And chunking and checking not good.
Yes.
Okay. Okay. Anything else?
Mm, the use of, for example, the grammar and vocabulary is not very good.
Okay. Right. Okay. You have some hesitation, yes?
Yes.
You feel that, yeah. Okay. Anything else? Anyone else? Who's next? Who's next?
Yeah, uh, I agree with above mentioned items, and also I think he could better his fluency and for about exploring ice.
Exploring ice. What do you mean?
For example, in this case, in relation to eyes, ideal concern and expectation, he could do better in relation of expectations of patient.
Okay. So he was concerned about cancer and future regrowth and anything else?
A scar of
And it's scarring, okay?
scar surgery, scarring.
Okay. Right, okay. Uh, but he asked these, didn't he?
Pardon?
Uh, what he did ask about these, he did mention these. Okay. Anything else?
No.
Okay. Who's next?
Yes, I think he doesn't listen to the patient completely, attentively.
Hmm.
Um, the patient asks something several times.
Okay.
Uh,
Um, okay. So, attentive listening, and yeah, it happens when you can't concentrate. Then, if you concentrate on the task and not on the patient, um, so and something I did on purpose was to swap two of the items, okay, to see if can can pick that up. So it was the second one was yeah this one the waiting for 2 weeks and scoring on the back. So I said scoring first and then after 2 weeks. Right. So yes, you need to listen to the patient, and it is not necessarily in the same order as it is written in the card. Okay. Um, right. Okay. Anything else?
and also, in the first part, he didn't ask any question. The patient asked how you can understand that it is not cancerous. He didn't ask any question about how diameter of the thing and about the time that he had this problem and like this.
Okay. Uh, yeah, I mean, if somebody has had it for his whole life and then it hasn't actually grown much, it's very unlikely to be cancerous. That's the way we say it. We say very unlikely. Okay. Anything else?
No, doctor.
Yeah.
Doctor, about this sentence, said, do you know what is it? I think we should say, do you know what it is? Am I correct?
That's correct. Yes, that's what I
Yes.
wanted to mention. Okay.
Yes. And the
Uh,
other thing is about the sentence. For example, I think that overuse this sentence, and he uses it when it isn't need. It doesn't need to use
it's
it. For
not.
example,
It's not.
so for
Yes.
that
It's not.
situation.
Okay. So right. Okay. What else?
This, I think, the other things that my colleague said.
Okay. And
I think the most important thing about information gathering was missed.
what do you mean?
There is no information. I think I didn't hear about one question from the patient.
Okay. Uh, right. So, yeah, you could have asked about how long have you had it, and when did you notice it first? Has it changed in size and things like that? You could have said that, and that helps with reassurance. The fact that a consultant has seen and said it's not cancerous, you cannot just assume it's not cancerous, okay? You need to do your own examination, your own history taking. So even you could examine the patient and say, well, let me have a look. And so basically, yeah, so about the size and nature and the duration and that sort of thing. Okay, anything else? Okay. They will give us as soon as possible the results. Okay. Is that correct?
No.
No?
No,
They
as soon
would
as
give
possible, the result.
the, as soon as possible is the end of sentence, I think.
Yeah, right. Okay. And what is your improvement? Okay. And let's see what is your improvement. Okay. No. We can see, yeah, we can see what your improvement is like. Okay. Um,
Or doctor, or what you are going, what you are getting. I have a special idiom. How
how you
you
are
how you
getting
are
on.
getting on? Yes, how you are getting on? Yeah.
And is grow or grows. Okay. And what is important to you? Okay. Important to you. So the preposition for important. Okay. We don't say important for you. We say important to you. And you said something that is not important to you, um, to worry or something like that. No, you cannot say it's not important to you. It's just you shouldn't worry. Okay. And please use this. It is very likely. Uh, or it is most likely, or it is highly likely. Okay, uh, and, you can use these in a lot of situations, and you can never say never. Okay, so basically you say, well, if the consultant said it's not cancerous, it is very unlikely to be cancerous. Okay, it is likely or unlikely. So uh, we don't say anything in absolute terms in medicine. So basically, we say, yeah, it is very unlikely to be cancerous. And he asks why it takes 2 weeks. You say, okay, it's because of administration, and also because it needs to be examined very closely and it needs to be tested. Um, so, so the people, the pathologists, should examine that very carefully. Okay. Um, so, any questions? Sorry?
No, doctor.
No.
No?